Hello, in this video I'm going to be talking about how to share your breast cancer diagnosis and treatment plans with your family. Before I go on, I'd love to invite you to subscribe to our channel. We're often putting out content not only about breast cancer treatment, but also topics like this, how to navigate a diagnosis, the people around you, and the different roles that you have in your life. I'd also love to invite you to go to Yerbba.com to learn more about the options that might be offered to you when you're diagnosed with breast cancer. Your Yerbba report takes all the information from your medical records, and this is not the same as your portal. It actually cross-references information in your medical record with the most recent up-to-date research and generates a report customized for you with the pros and cons of each treatment. And you may want to do that even before or when you're with your family. So it's really tricky when you have to talk to your family about your diagnosis. No matter your role in the family, you might be a husband, you might be a wife, a daughter, a sister, a mother, a father, and you have to have these conversations. You yourself are overwhelmed perhaps, or there's a lot of uncertainty about what's going to happen next, but you feel it's your responsibility and also a way to get support to talk with your family. How do you go about doing this? I'm going to offer some tips. Some of these may or may not work for you. It also depends on whether your family is nearby or whether you'll be having this conversation as a phone call. It may also depend on the strength of your relationships. You know, if you're estranged from your siblings, having this conversation is going to be very different from having the conversation with your child or sibling with whom you're very close. The key thing here is that in the absence of clear information, being uncomfortable with that is something to sort of get comfortable sitting with, that you don't know any more than they do. One key thing is to pick the right time and place. And there are a couple times that are not good. When you're under stress, when you're late for an appointment, when you're emotionally overwhelmed, whether it's with anxiety, fear, or sadness. Another time to perhaps avoid these conversations is right before you're going to bed, because your mind will be stimulated and it'll be spinning, possibly all night. It's also difficult when people are in different time zones, because what's night for you may actually be the time they get home for work, or when it's 1 o'clock in the afternoon. If they're 6 hours ahead, that can be really challenging. So I just want to encourage you to be mindful about your time zone and also the time zone of your family members. So pick a time when you feel as calm as possible and when it's a good time for the people you'll be talking with. If possible, be mindful about who you tell first. Some people will feel that they were not the right people to be told first, and other people will feel left out. When at all possible, having a conversation with people who all think they should be included at the same time can also be helpful, and we have a range now of options during which we can do that. I'd encourage you to be prepared. What would make this a good conversation for you? What would make this a good conversation for you? In other words, what need are you trying to meet with the conversation? If we go in without having thought about that, it's very likely our needs won't be met. Is the need to convey information? Is the need to receive support? Is the need to set some boundaries? If your family's been very intrusive, you may need to set some boundaries, and being crystal clear on the purpose of the conversation will help that conversation go as well as it might. Now, I don't mean to fragilize you. Your family may be 100% robust. It's still helpful to think about what would be useful. The next thing is to be very clear about what you know and what you don't know. So if you know you've been diagnosed with breast cancer and you know the side it's on, that may be all that you can say. I've been diagnosed with breast cancer in my left breast. You'll be asked a lot of questions. What's the prognosis? What's the next step? And you can say, you know now as much as I do. You may have to repeat this a few times. You may also feel that people want to jump in and tell you what to do. This is where being really clear on what makes this a good conversation will be helpful. And you can say, this is not a helpful conversation. I trust my medical team. Or you may say, I need some help finding the right surgeon. So figure out what it is you need, and then when people overstep their bounds or ask you questions, you can be very clear. This is not what I need at this moment. I wanted to be transparent and honest with you. I can commit to letting you know when I know the next step. I am expecting to hear from the doctor in the next 2 days. I commit to calling you and letting you know what I hear. I'm hoping that makes sense. Be crystal clear on what you need, be crystal clear on what you know. That will bring up a lot of needs for your family members, and what can you commit to? Is it to let them know after you hear or after you've made a decision? Is it to ask for help with certain things? Is there somebody who can come to that appointment with you to be your ears, because you may have that emotional overwhelm, and they can take notes and reflect back what they've heard. Be also mindful that they are going to have emotions. Those emotions may not match yours. You may be scared, anxious, calm, courageous. They may have completely different emotions. And with our family members, remember, this isn't just this conversation, it's all the other history you have. So if your child is used to being cared for by you, their emotions may be fear and panic. You won't be able to care for them. If your parents are used to swooping in and rescuing you based on old patterns in the family, codependency patterns, be prepared to either accept that help or to set a boundary and say, I've got this, I'm good, I trust my medical team. So unlike an acquaintance or even somebody at work, you have decades of experience with your family, many times. If you have a young child, that may not be the case, but some patterns of yours in your first family may play out with your children. So just be mindful of those patterns. It's not a bad thing to ask for help and have somebody there with you. You may have a good friend who was there at your appointment, and let your family know why your friend is there with you, because they were witnesses when that call came in. Another thing I'd love to encourage you is to be real with your emotions. If you're scared and you don't share that, your family will feel that, and they're going to pick up on things. They're going to pick up on your fear and anxiety. And you can say, I just want to share, I'm scared, I don't need you to fix it. Or I'm scared and I need reassurance. Or I'm angry, I just need you to witness that with me. I don't need you to fix it. Or can you validate my anger? This is again being crystal clear on what it is you need. The conversation may not go as you had hoped. And just, if you can, be as compassionate to yourself as possible and as compassionate as possible to your family. This is the first time they've heard this news, and the first time they might be called on to be something that you need them to be. I hope this is helpful. Join the conversation by dropping a comment or a question. If you have tips on how to cope with family members, what's been useful for you, we'd love you to share that with the Yerbba community. Thank you so much for watching, and we'll see you next time.